Today we will discuss about this NK-92 off-the-shelf cancer therapy, how this thing actually works in the clinical setup. So there is a master cell bank which is the NK-92 cell lines, and from that one of the vials, what they did is they make a working cell bank, and from this working cell bank could be this car that is inserted into the NK-92, but that is not mentioned here. But from the workflow, it looks like this working cell line is the NK-92 modified, or NK-92 with a car that can target the specific epitope of the cancers. And from that one of the vial, what they did is they maintain the culture into the regular cell culture, and then based on the patient dose, the dose that patient needed, these NK-92 cells are expanded, and once they are expanded, then they will go through these irradiations, which is one of the quality control method to avoid any mutated NK-92 further undesired mutated NK-92 cells to be inserted into the patient. So this they are irradiated. From that, only the high quality NK-92 CAR cells are being transfused into the patient. This is a general process, and in the previous video I have talked about their clinical trial results, and in this paper they have mentioned about the clinical trial results that the NK-92 based cancer therapy treatment clinical trial results are conducted in the early 2000s and some also in the late 90s, where what they did is they took the patient who are already have the high load of the tumors, or they are at a later stage of the cancer, and some of them are even reach up to a stage where the 25% of the tumor where the 25% of the overall body weights is contributed by the tumor. So, and in that case they have used this NK-92 based cancer therapy, and what they are able to and one more thing that they did is since the patient is already at the late stage, and also this patients are already in the severe conditions, these NK-92 cells are based off the NK-92 based off the shelf cancer therapies are transduced into the patient without lymphodepletion. So usually this lymphodepletion is done so that the immune system of the patient goes down, and this will not only increase the lifetime of this NK-92 or other therapies such as CAR T cells, and the more the shelf life, or more the circulation times of these modified immune cells, the better will be the efficacies of the treatment. So this is a general approach so far now in the however, there is a like in vivo CAR T cell therapies are also being tested. They don't need lymphodepletions, so that will reduce the cost. Let's come back to our topic. So here they do not go through this lymphodepletion since the patient is already at the severe stage, and by depleting immune system of the patient, it will further aggravate the conditions. So these NK-92 cells are transduced, and modified NK-92 cells are transduced into the patient, and the good thing is that the patient does not show a severe immunogenicities, and some of the patients even goes through five different course or 5 different dose of this NK-92 CAR therapies who respond better, who has responded better against this NK-92 off the shelf cancer therapies. However, the detailed analysis is not yet been able to done in those cases because of the severity of the patient conditions, and in some cases they are able to see the metastasis tumors has gone down significantly. So from that this NK-92 off-the-shelf cancer therapies got attentions, and I think from that clinical trial results, NK-92 off-the-shelf cancer therapies got some attentions, and people are working to make this CAR into the NK-92 cells. Sorry, instead of these CAR T cells, so that it can be used. It can be used at any point of time. So without waiting for the T cells from the patients that again go through the same process. However, there are some disadvantages also, and CAR T cell therapies are still dominant compared to the NK-92 cells, mainly because of the lack of clinical trial results that are done on NK-92 compared to the CAR T therapies. So that's all for this video. If you need to understand more about these therapies in detail, you can go through the reference that has been provided in the description. Thank you for your time.